today is talk to folks about open enrollment, the importance of health insurance and what open enrollment means, but want to definitely acknowledge who's in this room who are really key partners for us. So we're really fortunate to have two of our navigators who are organizations that provide on-the-ground assistance to individuals that need assistance enrolling in health insurance coverage, comparing their options, understanding what's in front of them. So we have PACE in the room, so we've got Ginny, Brooke, Bruce, Linda, and Debbie. We're so happy to have you. And also the Fishing Partnership, Deb, we're so pleased to have your partnership all year round. The work you do is so critical. It's especially important during open enrollment when people are taking a look at their options. We're also really pleased to have support from our elected officials here. So we have Representative Schmidt and Representative Markey. And we also have the city representative with Dr. Brenda Weiss, who does a lot of important work in connecting people with health insurance coverage here in New Bedford. So thank you all for joining us. So there's two key things we're talking about here today. It's the 10-year anniversary of the Health Connector, which in Massachusetts is a really important deal. We were the first state that embarked on health reform. The Health Connector was created as a part of that, as a way to connect people to affordable, high-value health insurance coverage. Of course, the whole nation followed suit. So we're proud of the groundbreaking role we played in that effort. So this is a special year for us just in looking back at 10 years of connecting people to health insurance coverage, both lower income individuals who qualify for subsidies, but anybody that doesn't get coverage from Medicaid or employer or otherwise. So it's an important year for us. It's also an important open enrollment period for us. So open enrollment starts next Tuesday, 1 week away, we can't believe it. And open enrollment runs from November 1st through the end of January 31st. And this is a time when we remind people who may not currently have health insurance coverage how important it is to get health insurance coverage. Obviously, Massachusetts really leads the way. We have a very high rate of our residents insured, but there are still people walking around without health insurance coverage, and it's really important that we connect those folks to the coverage that they need. So it's important to let people know that there is an easy place they can come to shop for their options. Navigators and on-the-ground assisters can help people make sense of a complicated process, and so we're so pleased to have partners in the room who help make that possible. The second group of people we want to be making sure we're reaching during this open enrollment period are current members. The Health Connector currently has about 235,000 members enrolled, and open enrollment is the time of year when they can shop and compare their options. They can switch plans if they choose to. There's a lot going on right now in terms of media coverage about premium increases around the country. Though that is an insurance company by insurance company decision, and so it differs from person to person. But for people who do see premium spikes, they can come and shop for high value health insurance coverage and find something for the same price that they had before. So that's really important that people know that they can do that comparison shopping. Navigators, in-person assisters are available to help people make those kinds of choices and make any updates they need to their account and finding the right plan that's appropriate for them. So we're talking about a campaign for open enrollment. We're calling it Stop, Shop, Enroll. So it's the time to stop, look at your options, get into coverage if you don't have it already. If you do have it, look at your options, and then enroll. It's not just enough to pick a plan, you have to pay for it to effectuate that coverage. So for people looking at January 1st coverage, that means paying your premium by December 23rd. And again, we know the navigators and on-the-ground assisters can help people with making sure they're getting their premiums in and making sure that that coverage becomes real. So that's really what we're doing here today. We're trying to make sure that the messages are resounding in the communities. We know from people, both those that are remain uninsured and those who have coverage, how important it is to have these messages come from people in their community who understand their neighborhoods, their families, their communities, and that's why we're so appreciative to have the support on the ground here in New Bedford. And we're doing this tour around the state. We've got all kinds of stops. We came from Hyannis this morning, and we had your colleagues from the Fishing Partnership down there, which was fantastic. So great. And so we're just so pleased because we see over and over in research and feedback from real individuals and families, having that in the community assistance is critical. Health insurance is complicated, but it is so important. And so bridging those two worlds is really key for us. So thank you for your support. We'd love to have a few remarks made by Rep. Schmidt and Rep. Markey, and then have some folks from the Navigators speak as well. So if you guys would like to share a few words, we'd love it.
Well, Chris and I are, Representative Markey and I are delighted to be here. And we're representing the New Bedford delegation, the two of us, Representative Cabral, Representative Kazera, and Representative Strauss. we're here to emphasize how important this is, and we're delighted to be here at Tia Maria's. We appreciate their hospitality, and of course we recognize that we're here with our partners in city government, Health Director Weiss. Very nice to be working with you again. I guess from my point of view, I would just like to say that I love the fact that you've organized people who can actually, well, we all know it's important to have health insurance, and the Health Connector is a wonderful way to get affordable health insurance, and there are grants available to help people pay for health insurance, so everybody ought to look into that. But the fact that you have, and there is a website, but some people have difficulty navigating a website, even though ours is particularly good. And for anybody who gets discouraged or frustrated on the website, knowing that you can go to PACE, you can go to the Fishing Partnership, sit down and talk with somebody who really knows what they're talking about and help you get enrolled is just a wonderful aspect of this program. Thank you so much to the Health Connector for being here.
Thank you so much.
I look at it as it's probably the two biggest parts or non-profits that the city has in relation to affecting employees. People who are also, who haven't had a chance to work, is PACE, who deals with a lot of low-income individuals, hardworking people who, 15, 20 years ago would roll the dice as to, hey, should I pay the insurance premiums or should I pay a rent? Should I get groceries or should I pay insurance? Those are decisions that I know Bruce and PACE has always dealt with. This is a great opportunity. The same thing with fishermen, with regulations that affect our biggest part of our economy. Having the Fishing Partnership available to those individuals who work on the waterfront, which is our backbone of our economy, helps the most. It gets the bang for the buck. And I think that's the biggest thing when we look at the Health Connector is why are we here? We're here because 25 years ago there were thousands and thousands and thousands of people without insurance. And there were thousands and thousands of people going to emergency rooms, and there were millions and millions of dollars being spent in hospitals like St. Luke's that are disproportionate hospitals, struggled and struggled and struggled and couldn't get anything done because it really provide services that they do now. You go to Charlton for legitimate heart surgery. You go to St. Luke's now and you have serious brain surgeons, neurologists, and you have great orthopedics. You have all those things that basically in Bedford and Fall River have never had before. It has a lot to do with the ability of those places to now count on getting paid. Granted, it's not enough, but it gives them the opportunity. And again, South Coast Hospital is the largest employer in New Bedford, making sure that they can continue to expand and provide the best health. And again, when you look at New Bedford and Fall River, there are serious health issues. I mean, as I always say when I talk about health, is our next generation struggles with a lot of things, but our next generation's cancer is obesity. And obesity brings so much more to the table than just cancer. At least cancer can be treated with one types of treatment. You have diabetes, heart disease, all types of things with obesity, and it's becoming more and more expensive. So those are the things that we hope we can retain some costs, focus more of our energy to the things that are needed in our particular area, and I think the Health Connector is the way to do it. So it's not only good financially for you as a citizen of Massachusetts to get the health insurance. It's cost effective for you, but it's better for the community. It's a really commonwealth issue. It's not just about you as an individual, but you're helping so much more when you do this. So it's really, really important, and it's not worth rolling the dice. It's really not worth rolling the dice when you can pay for it. I don't want to pay for my life insurance, but I know I got to do that every year. But it's the same idea. You just want to make sure you pay for your health insurance to get it done. So I'm appreciative of you guys coming around. Hopefully we can get the word out and market a little bit more. And now I think November 1st may be the new tax day, right? We all remember April 15th, and now we got to remember November 1st. So stop, shop,
That's
enroll, right?
Thank you. That's so fantastic. Well, we feel so fortunate. Again, we hear over and over from members how much it means to them to have people in their community that they recognize, that are where they are, where they live, work, and play. And I think that's just essential to supporting people through this open enrollment period or any other time of the year when people have questions, and making sure people know the Health Connector is there, that subsidies are available for people. So many people qualify for low cost or no cost plans. It's really important for people to understand that, particularly the uninsured often don't think that they would qualify for something affordable when in fact they may in fact qualify for something that's low cost or $0 premium. So you guys are the front door to that world for people. And
I love telling them that. I love that.
So I am Brenda Weiss, I'm the health director. So one point I want to make that I think is really important. I have a health insurance enrollment program that's with the school department called Health Access Kids, New Bedford. We've had it for 2.5 years under a grant from the National League of Cities. It's been really successful. We coupled it with our dental program with the school, and it helped us, put a tangible face on insurance enrollment, because a lot of people don't really understand what it means. But when you get dental services while you're covered, it sort of makes it more tangible for schools. But 2 points I want to make is we often think about insurance as something we need when we're sick, and we go to the emergency room and we go to the doctor. But what I think is really more important, and especially from the public health standpoint, is prevention. And so to keep yourself well, and insurance covers wellness, and it keeps you out of the doctor's office and out of the emergency room. And I think a lot of people think, well, that's going to cost me extra, but it's actually a lot of those preventive services are included within the insurance package, and I think that's really a good message for people to hear. And last point is, I think the educated consumer is really important, because what we find is that a lot of people will get insured. We assist with enrollment also. We work a lot with J.J. Bartlett and his group, and we have worked with PACE. But then the next year when they have to re-enroll, they forget about that, or they don't know how to do it. So our goal this year has been a lot about retention. Try to keep people informed about the need to re-up the next year, or to keep the insurance going, not to have a lapse in the insurance, because that they show up in the emergency room, they're looking for care, and now all of a sudden they're not insured, right? So that's more catastrophic. So we've worked a lot with the school department and the school nurses to do that education and outreach piece, and we even track for the students their enrollment status on the school database, so that before the kid rolls off of insurance, the nurses will alert one of the navigators to say, hey, you need to reach out to this family and make sure they stay retained. So it's our goal has been about the educated consumer and retention, and really focused on the youth. And by focusing on the youth, you get a lot of families also, because they have brothers and sisters and mothers and fathers. So, yeah.
Thank you so much. That's so important.
If you don't mind, just from a perspective of a navigator agency, PACE has been doing work in the public health arena for the last 25 years, and it's something that we've really worked hard on. But what these Navigator grants does is it gives a place for local people to connect with. As Representative Schmidt-Markey said, not everyone either has a computer, has internet access, or computer literate. So it's a daunting task for a lot of people to go on there and do this fairly significant event in their lives. So to actually be able to come down and talk to a Deb or a Linda or a Brooke or a Ginny, to help folks, understand the process, navigate through the process, and then end up with health insurance. And in about 85% of the cases, a subsidy on that health insurance is really critical, and is a critical part in every community. So every community that the Health Connector has navigators in, has that connection to a real person, that someone can go in there and not have to deal with, a computer. Speaking as a baby boomer, we didn't grow up with computers. The millennials in that group, they've had computer access their whole life, so it becomes natural for them. One of the other things that we were able to do at PACE, because it was a local option, is to develop a senior program to work with folks as baby boomers approach the era of Medicaid. And it's a big unknown. So we've got a specialist who works with folks who have to choose Medicare or are just getting into the system and don't understand it. So we provide that service also. But I think that's the benefit of having local programs. We know what the community needs are, and we're in tune with what's happening in the community.
We're so appreciative of the work you do, and looking forward to partnering with you during this open enrollment period to get the messages out, to focus on informed and educated consumers and helping make sure people get through this open enrollment period, and that we get in even more people so that we can get ever closer to 100% of our residents having the coverage they deserve.
I think Brooke and Deb make a great point about literacy, because the health insurance is a evolving process, a product. I know as an employer who provides health insurance to 185 employees in the organization, over the years we've had to take steps to try to minimize the increases that we've had from our health insurance. From several years ago paying 100% of health insurance down to a portion of health insurance, and then having to institute a deductible. People didn't know what a deductible was, and it really changed the way people used their health insurance policy. So the literacy in healthcare is extremely important, because it is an evolving product, and it is going to continue to evolve.
Yeah.
I think another point is really something we should emphasize is the individual mandate. It always made me chuckle when people bristled at the fact that the government was forcing you to have health insurance. Because the government ended up paying for your health insurance anyways. When you're in the emergency room and you had no health insurance, someone else had to pay, because you couldn't certainly pay that whole. And the fact that we're forced to have insurance on our car, and nobody thinks twice about it. Matter of fact, it's illegal to drive a car without insurance. But bristle at the fact that you're going to insure your health.
Right.
It's the most important thing that we have as individuals.
That's exactly important.
That's what I'd like to think, that you're holding their hand from the minute they walk into your door, and as they're walking out the door, they're going to. They have a PCP now because you assisted them to find one, and you've probably even called to make an appointment for them so that they're going. And so when they leave, you're like, let me know how that appointment went.